Ideally, you should stay within 5 kilos of your preferred BMI. I knew it! Knew that was going to happen at some point.
4 out of 5 of us will get back pain at some point in their life.
In this video, we'll tell you the top 6 ways to prevent yourself from being sidelined with back pain. This is Mohammed.
This is Andy.
This is the Neurosurgeons channel.
And this is the only place where you find 2 neurosurgeons talking to you about everything about the brain and spine. The first thing you can do to help with your back pain is to do more exercise. Some people think that not doing any exercise will help back pain. If you are in pain, maybe rest for 1 or 2 days might be helpful. However, doing exercise will help to relieve the muscle spasm, will help to relieve the back pain. Experts find that it's very useful to do that. Forms of yoga and other exercises can help you with that as well.
The second thing you can do to reduce your chance of developing back pain is to manage your body weight. Excess body weight, especially around your midriff, pulls your center of gravity forward, and this puts excess strain on your lower back and it increases your chance of developing back pain. Ideally, you can try and stay within 5 kilos of your ideal body weight to reduce your chances of developing back pain.
The third thing that you can do is to stop smoking if you are a smoker. Smoking not just affects your spine, but also affects the whole body. Smoking restricts the amount of blood that goes to the tissues in the body, and that will reduce the amount of nutrients that goes to all the body, including the spine. Smokers has more tendency to develop more diseases and back pain compared to other people.
The fourth thing you can do to prevent back pain is actually to modify your sleeping habits. We spend approximately a third of our lives asleep, and the position you sleep in can affect how much strain is on your back. Ideally, you should sleep on your side, and if you suffer from back pain, you can reduce the strain on your back by placing a pillow between your knees. If you like to sleep on your back, then you can place a pillow beneath the back of your knees. Again, this reduces the strain on your spine. Sleeping on your front is probably one of the worst positions because this extends your spine slightly and increases some of the stress and strain across the joints. In addition to your sleeping position, you can modify the firmness of your mattress. If you're like me, you like a really firm mattress. Some people prefer a much softer mattress. A softer mattress gives a bit more, and if you have back pain, this can actually exacerbate it. A cheap way of changing how firm or soft your mattress is without spending lots of money is to place a bit of plywood under your mattress and to make it a little bit firmer and see how you get on with your night's sleep and your back pain.
The fifth thing that you can do is to pay attention to your posture. You can do a simple test. Stand by the wall and try to get your heels, calves, your back, shoulder, and the back of your head touching the wall. That's the best position for your posture. Then when you walk away, if you bend forward or your shoulders are bending forward, this is not a good posture. Try to correct it directly.
Finally, one of the most important things you can do to reduce your chance of developing back pain is to lift heavy objects carefully. Ideally, you shouldn't use your back to bend forward and then extend to lift heavy objects. Instead, you should bed down, brace your abdomen, which means contract the muscles around your core, and then push with your legs to lift heavy objects off the floor. So using your legs to push rather than your back to pull is the safest thing you can do when lifting things from the ground.
These are not the only things that you can do to stop back pain. There are more things that you can do. It's all about your lifestyle modification. Stay tuned for our next video where we'll be discussing 5 methods about the spine surgery. Thank you.